Autism Spectrum Disorder is a complex condition. The problem of autism is, if left untreated, a child may be unable to live independently in future life. The average age for diagnosing autism is around 5 years. The earlier the diagnosis and intervention, the better the prognosis. That's why it's crucial to notice the early signs of autism even before the age of 2. Simple definition of autism is when children have problems with communication, repetitive behaviors, and sensory sensitivities. It is termed spectrum because of the great variation in symptom severity, ranging from very mild to very severe. We will explore 7 earliest signs of autism that a parent can watch for to spot autism at its earliest. The first, when child does not respond to their name by the age of 9 months. This is a strong predictor of autism. While other children may sometimes ignore their name when distracted, a consistent lack of response is more indicative of autism. Also, if a child does not engage in games like peekaboo, also when they avoid eye contact, collectively it is called social challenges. The second sign is lack of social smile by the age of 6 months. It is when interacting with parents, a child may not smile back. Social smiling is considered important developmental milestone, and lack of it is considered important sign of autism. The third sign is communication problems. An early sign here is delaying babbling, such as saying dada or baba. These are precursors of speech, and a child should be babbling by 9 months. Fourth, when a child does not point something they are interested in by the age of 12 months. For example, pointing a toy they want. These nonverbal communication forms are fundamental for language development and is considered strong determinant of autism. Fifth sign is repetitive behavior, for example, hand flapping, the child rapidly shaking or flapping their hands at the wrist, often in situations of excitement, stress, or when they are trying to express themselves. It serves as a self-stimulation for child, helping them to manage sensory overload, express emotions, and cope with anxiety. While hand flapping can be part of normal development, it is more pronounced and frequent and contextually inappropriate in case of autism. Sixth sign is rocking. This means the child moves their body back and forth while sitting or on their hands and knees. In this way, the child suits themselves in distress or discomfort. Rocking can be a sign of normal development as soothing mechanism. However, contextually inappropriate and frequent rocking is a sign of autism. 7. Children with autism commonly spin objects, or they watch spinning objects with fascination due to their visual stimulation of the spinning motion. This characteristic is part of restricted interest, repetitive behavior, and sensory sensitivity. While many children can be fascinated by spinning objects, but an intense fixation can be indicative of autism. 8. Meltdowns, not tantrums, are notable sign. For example, a child with autism at a busy birthday party may experience sensory overload from noise, become overwhelmed, and have a meltdown, unable to be consoled or calmed by typical soothing strategies. Meltdowns, unlike tantrums, are usually an overwhelming reaction triggered by buildup of external stimuli or internal dysregulation, and the children often have little control over them. Unlike tantrums, meltdowns don't have any specific cause or goal. For example, get a toy. Tantrums often have a goal, while meltdowns are a sign of sensory or emotional overload. Understanding the difference is a key, providing appropriate responses and support for the child.